Hi, I'm Amy Shapiro. We're here today at Calcalist and CTech's Mind the Tech Berlin 2025. We're joined by Jonathan Reiner, Senior Neurologist at Beilinson Hospital. Jonathan, thank you so much for joining us today.
Thanks for having me. Nice to meet you.
It's a pleasure to have you. To start off with, Jonathan, could you introduce yourself? Tell us your full title and what it is you do at Beilinson.
So my name is Dr. Jonathan Reiner. I'm a neurologist. I'm a movement disorder specialist, and I run the deep brain stimulation and neuromodulation service at Beilinson Hospital.
Mm-hmm.
And I can talk about neuromodulation if you'd like to hear about
Yes,
that.
I do want to hear more about what exactly is neuromodulation and why is it considered one of the most innovative technologies today?
Okay. So neuromodulation is the ability to influence and change the brain's electrical activity through precise stimulation using either electrical, light-based, or magnetic kind of inputs. It's a well-established therapy that's been around for a while now for neurological disorders such as Parkinson's disease, through basically implantation of deep brain stimulation kind of technologies that through electrical stimulation we're able to assist and kind of alleviate symptoms that people suffer from in these neurological disorders.
Mm-hmm.
And the amazing thing about neuromodulation is not only the ability to kind of change through electrical stimulation kind of the brain's activity, but recently we're shifting into kind of an era whereby we're able also to record the electrical activity from within the brain. So for the first time ever, we're able actually to record simultaneously while we provide the therapy for these patients, the deep kind of brain talk in the brain in order to kind of gather information about how the brain works and gain some insight into kind of each and every individual's kind of symptoms and brain's activity. So we're shifting kind of from an era of one-size-fits-all therapy to a truly kind of personalized, adaptive brain therapy.
Absolutely fascinating. Obviously, we're in the midst of an AI revolution. How does, if at all, AI play into this, into neuromodulation?
Okay. So what's happening now, basically, because AI is basically allowing us to gather this a vast amount of data and analyze this vast amount of data from people who are walking around with these kind of technologies which record their brain activities while they're in a real-life setup rather than in an experimental setup, while they walk, breathe, talk, laugh, cry, feel. And whereas previously it was almost impossible to analyze this vast amount of data just because of resource kind of capabilities, now we're able through AI to analyze vast amounts of data and through basically advanced kind of learning models to find kind of hidden patterns within the brain and learn about kind of changes that may kind of give us information about once again, brain health, brain activity, maybe to allow for predictions of brain disease in people who are healthy, and to basically gain insight into how the brain talks.
Absolutely incredible. No, it's incredible technology, but obviously I have to ask if there are any, or what kind of risks or ethical considerations there are for you.
Of course, that's an important question. I mean, with any kind of technology that allows us to gain insight into the deepest, most kind of raw data from the human brain, we obviously need to keep some sense of modesty, and it's important to kind of protect neuro privacy, what's called, the ability of each of our patients or each individual to maintain their autonomy, their agency. Obviously, not to develop technologies that are able to read a brain without full cooperation and transparency and consent from our patients. But at the same time, also, we're able to now gather kind of anonymized data from various individuals all around the world and collect them into global databases that will eventually allow us to learn about the human brain in general and not in an individual manner, to allow for basically better therapies and hopefully understanding of the human brain. And the last thing to say in that respect is that when we talk about kind of neuromodulation and about our ability to kind of read the brain's activity, we obviously need to think about kind of where's the limit. I mean, for now, we're using it to treat neurodegenerative disorders diseases, but maybe in the future we'll be able to enhance human capabilities. And then we need to ask ourselves, what are the limits here? How do we keep kind of, equality, social equality, access to whatever health systems we're developing, and at the same time kind of make sure that we act from a standpoint that looks into brain health rather than, anything malicious or that may cause any kind of commercial advantage of some sort.
Right. You kind of touched on it just now, but finally, I want to ask you, Dr. Jonathan, what the future looks like for neuromodulation.
Okay.
Where is this all going?
So in the near future, what's happening now is because we're able to read the electrical activity from within the brain, we're developing now stimulators that are adaptive, that respond to the changes in the human brain, that gain insight into kind of symptoms. For instance, in Parkinson's disease, if a patient, we now know the electrical signature within the brain of tremor or rigidity or slowness of movement, and we developed kind of systems that allow us to in a closed loop fashion, basically change the stimulation in accordance to the symptoms as they develop. And now, as we'll gain more and more insight into the brain, we'll be able to develop further kind of technologies to respond to changes within the brain in real time. And secondly, the fact that we're able now to look into signatures of human traits, emotions, cognition, and categorize them into various categories. We're able now to think about kind of prediction models for brain diseases and brain health in the future to allow us to be kind of healthier and better as human beings.
Well, it's truly remarkable technology. I can't wait to see what comes next from you and your team at Beilinson Hospital.
Thank you very much.
Dr. Jonathan, thank you so much for joining us today.
It's been a pleasure. Thank you.